Ball with Alzheimer's Diversity Outreach Services. Now we're down here on the historical Greenwood District. I couldn't think of a better place to have this kind of discussion with my good brother and friend, Guy Troop. Now he is the founder of the Black Wall Street Liquid Lounge. And what we're trying to do is to create an environment and an atmosphere and community where we can have open conversations. And so we're going to have some really dope discussions around what we can do to better educate ourselves and make ourselves aware and how we can evolve ourselves in the community. So, Troop, you gotta help us understand, man, how excited are you about this moment, this month, and just being a Black business owner and creating a space to have these kind of dialogues?
Well, man, I'm excited about having you. I appreciate you guys choosing Liquid Lounge, Reverend Ball, you, your dad, your mom, joining the Liquid Lounge family to educate our people. And what better place on ground zero of historic Black Wall Street in Greenwood District?
Yeah, I mean, we're getting ready to celebrate Juneteenth, and we lost a lot. It's a lot of history that we don't have, which means it's a lot of information that we need, right? And so one of the things that we want to do is make sure that we have a forum to get educated. So every month we're going to be doing these Liquid Lounge roundtables, if you will.
Yeah.
And I'm excited to actually just be in the city, right, where it's ground zero for what took place 100 years ago, but where we can serve as an example of how to be open to have these kind of conversations. Because like you told me earlier, Uncle Johnny, he seemed like he was going a little crazy, right? And we stuck him in the back room.
That's right.
But imagine if we were better educated, we was aware of what was really taking place, how much more we would be able to assist each other, right?
Yeah. Well, you think about the model of Black Wall Street and Greenwood and what the vision of O.W. Gurley and Booger Williams and J.D. Stratford, what they really had was a shared vision around community. And so mental health is no different. If we can share our struggles, if we can share our pains, if we can share our diets, and really get back to oneness, I think we got a shot at beating just about anything. So I'm excited that you guys chose this place. I hope that what it will do is serve as a launch pad for other conversations. Physical and mental health are just two aspects, but dietary issues, right? Spiritual issues, just oneness is what this whole thing's about, man. So I'm excited and can't wait to join into the round table.
God, we appreciate you, man. Again, you and your wife being a part of this community, coming back to Tulsa to extend this legacy here. I couldn't think of a more appropriate person than you to continue to not only carry the torch, but to pass it down to yourself and the next generation, man.
Yeah, well, I'm excited. I appreciate it, man. What we'll do in these conversations, we'll create a special beverage for Alzheimer's, for all of the wellness issues, because I think part of this conversation needs to be normalized and really just simple. So coffee conversations is a big part of our messaging, and we're excited to join in with you guys to make it happen.
Good deal.
All right.
Relaunch. The struggle is still real. Good evening, everyone. My name is Beverly Ball, and I serve as the Executive Director for the Alzheimer's Diversity Outreach Services organization. And today we are honored to be in partnership with our local and national Alzheimer's Association in recognizing June as Alzheimer's and Brain Awareness Month. We also take the time to celebrate Juneteenth, historically recognized on June the 19th, and also called Freedom Day, Jubilee Day, and Emancipation Day for our ancestors who celebrated the end of slavery. Today, we want to say thank you to all who joined us in February for our 17th annual Out of Africa Healthy Brain Strategies, first live streaming virtual event. If you missed it, please go to our website, alzoutreach.org, or you can check it out on our Facebook or YouTube page. And for more information about our organization and services, please call 918-514-3154 or email beverlyball@alzoutreach.org. The Out of Africa Healthy Brain Strategies event is still gaining recognition across the nation as being one of the largest educational events for African Americans about the Alzheimer's disease and other related dementias. Our goal will remain the same: to educate about the Alzheimer's disease and other health-related issues, to know the facts, and to encourage individuals across our city, state, and nation to join the movement in living a healthier and more productive life. Our mission and purpose will also remain the same: to assist in the education and public awareness of the Alzheimer's disease and other health concerns related to dementia and its impact on diverse populations, especially within the African American community. Now, at this time, we would like to recognize our guests for today's roundtable discussions. Each of them was gracious enough to accept our invitation to the table to discuss health disparities within the African American community and diverse populations. It is our hope that our discussion will lead us into living a more healthier lifestyle and encourage our family members, our friends, and the community and the nation to join us in the movement to change the statistics and the projected lifespan of African Americans and other diverse populations. We are excited to have with us Wendy Williams. Wendy Williams is the proud owner of the Health and Safety Education Consultants Training Center, LLC. She is also the president and founder of the Eastern Oklahoma Black Nurses Association, which is a local chapter for the National Black Nurses Association. We also have Crystal Stewart. She has been an instructor for the Tulsa Technology Center for over 10 years. She holds a Bachelor's of Science in Community Health, minor in African American Studies, and minor in Psychology from Eastern Illinois University, a BSN from the University of Oklahoma School of Nursing. Mr. Michael Stewart, who is completing his BSN from the University of Oklahoma in nursing. He is a licensed practical nurse, highly skilled career professional with more than 17 years practical experience in hospital, home health, long-term care, and correctional facilities, established in patient support, including assessment, counseling, education regarding medications and treatment, lab work, documentations with care plan for diagnosis and administration of treatment procedures. We have Anita Williams. Anita has worked in the North Tulsa community as a nurse practitioner since 2014. In 2018, she founded A&M Healthcare Clinic, LLC, where she currently practices. Anita is committed to providing high quality, affordable health care in Tulsa and surrounding communities. She is a member of the American Academy of Nurse Practitioners, the Association of Oklahoma Nurse Practitioners, the National Black Nurses Association, and the Eastern Oklahoma Black Nurses Association. Alicia Latimer, a strong community activist who serves on various boards and knows from firsthand experience how devastating the Alzheimer's disease affects the family and individuals who are diagnosed with it. Jerry Higgins, a faithful volunteer for the Alzheimer's Diversity Outreach Services Organization for the past 10 years, and who has also cared for a loved one who experienced a health crisis and needed the assistance of her loving family. Let us now join the round table discussions. Health disparities within the African American community and diverse populations. Welcome to the table. According to the Alzheimer's Association, African Americans are at higher risk for the Alzheimer's disease. We want to know why. We would love to know why African Americans are highest among the stats that put us into the Alzheimer's disease process. Ms. Crystal, because of the position you're in as an educator for the Tulsa Tech Center, what would you say to your students that you're teaching concerning Alzheimer's or any of the diverse problems and disparities that you see in our community?
Thank you, Reverend Ball, first of all, for bringing us all to the table. This is a much needed conversation, and I am grateful to have the opportunity to be an instructor and be able to pour into the students information in regards to Alzheimer's. I know when I went to nursing school initially, it was not a subject that was covered very well. And so that was one of the things I really wanted to do, was to make sure that my students left already imparted with some information about Alzheimer's. Now, going back to your question in regards to what makes or what puts African American individuals at higher risk for Alzheimer's, are going to be those underlying issues, challenges, health conditions such as high cholesterol,
Yes.
obesity, diabetes, hypertension. So we have some of those things that we can change, and a lot of those things that I just mentioned are modifiable, meaning that there are things that we can do as individuals to help to reduce our chances of getting Alzheimer's. So many times people say, well, you know, it's just something that happens. And there are some things in life that just happen, but then there are some things in life that you do have control over. And as individuals, we need to let our communities know that we do have control over some things, a lot of things in regards to our health. So many things we feel like are out of our control in our communities. And it's empowering to let people know that yes, there are some measures that you can take to reduce your chances of having Alzheimer's.
That's good. Thank you so much for sharing that. I would like to ask you, Ms. Williams, you own your own medical facility, your office, and you are a practitioner. So what is it that you see in your clinic that is plaguing the African American community? What type of patients are you seeing?
Okay, well, I'm just going to piggyback off of what Mrs. Stewart said. You know, those preventable chronic diseases like diabetes, high blood pressure, you know, our communities it's just rampant.
Yes.
And those things, again, like Ms. Stewart mentioned, are modifiable or even preventable, you know, with a lot of education and making sure you come before, you know, the disease has gotten so out of control.
Right.
That, you know, now you're really, really high risk for Alzheimer's, heart attacks, strokes, and things like that.
That's right.
So we focus a lot on prevention and education.
Right.
Because once people understand the impact of these things, then, you know, the next step would be how can we, you know, partner together, because it is a partnership. It's a healthcare partnership, healthcare provider partnership with the patient. You know, so we work together on things that can help decrease, you know, those things that put them at risk.
And I actually see you in the community.
Yes.
Because you are part of health fairs, which is part of educating the community. You're not just in the office. You have a presence in the community, which is taking it beyond your office. So that right there is going to help educate more and more of our community members and their families. So we thank you for that. I'm going to ask you, Wendy, as an instructor also and owning your own business, what have you seen that has affected our community? Now, we talked earlier about COVID. We were talking about that before we opened up the discussion. And you mentioned that there are so many people that don't realize the effects that COVID has had in our community and why the numbers have gone up as far as deaths among African Americans and people of color. So can you talk about that?
Sure, and thank you for having us at the table. And again, Anita and Crystal, they really honed in on the real issues that really bring out why we are so affected in our community, why we're dying earlier, and living shorter, and being diagnosed with Alzheimer's at a higher rate. And so those underlying conditions, the high blood pressure, the diabetes. And so now we have COVID on the scene. So now we hear in the news a lot about COVID and cardiovascular disease. But what we're not hearing is that COVID also affects individuals as it relates to early Alzheimer's. So we have individuals who are dying of Alzheimer's disease as a result of being affected with COVID. So yes, we have a vaccine, and we absolutely, everyone at this table absolutely encourages individuals to get the COVID-19 vaccine if you are able to. it is going to help in our community tremendously. Yes, we have history with
Yes.
medication
Yes.
and how it affects us and how it works on us and how we're not a part of the process when it comes to rolling out different medications. But that's something we can do something about. We can start participating. We can start sharing information. You see our faces in the community. We're going to be talking to you about these things. And so we're going to get you a little more acclimated, a little more comfortable about what you have control over as far as your health is concerned. So, yes, we absolutely have a lot of work to do, but it is absolutely accomplishable in education, and providers like Anita who educate and will not let you leave her office until we have a clear understanding.
That's good.
And she's going to ask you the behavior that you exhibited. How's that working for you?
Right.
And so she's going to put it on you and make you make some real decisions. And that's what we need to do with each other.
Right.
We are our sisters and our brothers' keepers.
Right. Be accountable.
Be accountable, right? Absolutely.
We do need accountability in our community as a whole, and that's one of the reasons that we have formed the organization Alzheimer's Diversity Outreach Services to be an extension of what was already being taught, but being able to go deeper into the African American community to make sure. And I was very appreciative of the Alzheimer's Association 20 years ago when they came and said, there is a need in the African American community. Would you help? So I was able to do that, and I'm grateful for the opportunity that I've had to share the information. And you all know we've been doing this now for, the event has happened for 17 years, so I'm really grateful that we've had that opportunity, but we still have more work to do. Now, as another professional, Mike, you are in the community, and you have worked with hospice patients. You have worked with different types of facilities to assist with individuals that not only have Alzheimer's, but also have other illnesses that are crippling our community, killing our loved ones. What would you share at the table concerning those things that you have experienced as a professional?
First of all, thank you, Dr. Ball, for, I call you Dr. Ball.
That's okay.
But you said Reverend, Doctor. But anyway, I'm glad to be here. I'm glad to be among so many beautiful African American women. For me, right now, I do hospice, so
yeah.
I think for me, what I see is a disparage in our community is that African Americans, we tend to look at hospice as a death
Sentence.
So
right.
when you introduce the word hospice, they automatically think of death.
Yes,
Like,
it's a fear.
right, it's a fear. So, and one thing I like to believe, and I say this is kind of my motto, is we're not waiting on our patients to die, we're helping them to live.
Amen.
So
That's
we
good.
can still provide quality of life to somebody who's at that stage of, say when I see somebody, they probably already have terminal illness.
Right.
So hypertension, chronic kidney disease, heart failure, Alzheimer's, dementia. So at that point, I'm dealing with people who have behaviors, and now we're dealing with family members who are struggling to provide care.
Right.
And I think a community, we need to know that there are a lot of things available, and that caregivers who are strained, they can have like respite care,
Right.
things like that will give family members a break. I think education is very important.
Right.
A lot of people are not educated on like signs and symptoms.
That's it.
And they think that when mother or father behaves badly, if you can use that word,
That's right.
that it's mother and father when it's really the disease.
That's right.
So I think educating people on the signs and symptoms of the disease would help out a lot in our community. So coming from that perspective, I think just really educating people would really help a lot
Right.
in our community. So
That's good. And I think that's our responsibility too, all of us, not just as professionals, but for Alicia and for Jerry, who have lived through that as family members, to live through it and then to learn from it, because you know that there are genetic ties, but the genetic ties are the lesser of the numbers. Okay, there are genetic ties, and you need to know your family history. So that's something that you would be interested in doing. Is okay, I need to know my grandmother had this, but I need to know how far back did this go? Who else showed signs? Many people did not know that when Dr. Alzheimer's discovered this disease, he discovered it in a 50-year-old woman, and she ended up in an insane asylum. Okay, because in the 1900s, they did not know, and they had not accepted his findings. So we are already years behind as far as researching and knowing what the science and all of that is. So if she ended up in an insane asylum, can you imagine how many people back in the day ended up in asylums? Because people got it confused with mental problems and not the disease. So there is a difference, and we need to educate people. We need to educate people about hospice because of the fear. What people don't know about the hospice care system is that we've already paid. It's been paid for in advance, and people need to know, use the resources. That's another thing. African Americans do not have the resources that other cultures have. We don't. Our loved ones end up in the lesser facilities, or they cannot afford to place their loved ones in a facility that really has the quality care. So that's another thing when it comes to being a caregiver. Alicia, can you share with us, maybe some of the things that your family experienced with your grandmother? Did you all recognize the signs when she first went into that first phase or that first stage? Did you all know what was happening to your grandmother?
We really didn't. I was in college, and grandmother, her hand began to just shake on its own. It constantly shook, and we had no knowledge about it. We just said she's old. Right. That's what grandma does. But she began to behave more erratically. She didn't know us sometimes, and we just said it was old age.
Right.
Back then it was just old age, and eventually, and she got where she was angry and mean sometimes, and she was more aggressive toward my mother, it seemed, until my mother finally said she just could not take it anymore, and she put her in a nursing home. And we would go visit her, and she might know us and she might not. But it was always that shaking. Parkinson's disease, I think it was. But no one explained that to me. I didn't correlate that with dementia. I didn't know why her hand shook. And I think that's a big problem in our families, that we don't explain to people, this is what's happening. There can be a genetic link. We need to understand and then watch for this same symptomology, because as you're getting older, we call it old, just old. So I'm getting older. My husband is getting older. So if you're forgetting, or I have ADHD, so is this part of the ADHD, or is my husband's ADHD matching mine? So we're not. So, there's no knowledge of, like you said, the symptomology. We don't know what it is. I just say, well, we're getting older. But what if that's not it?
Right.
And so that's why it's important to know.
So that's why it is so important for individuals to be properly diagnosed. Would you agree, Crystal?
Yes.
Would you agree?
Absolutely.
Would you agree? Properly diagnosed. And that's one of the things that we are lacking in our community. We would rather think that it's just something going on and they're just aging, but we don't know that there is a difference in aging properly and having Alzheimer's disease. It's a brain disease, and most people don't realize that, and so they don't take their loved ones to be diagnosed. So that's another thing that we need to know. People need to know. They need to know those 10 warning signs. Okay, Jerry. I know that you became a caregiver for your mother, and I know that it was very personal and painful at the same time. So having to do that, what did you learn as far as how to care for your mother? And did you feel you were equipped to take care of her?
I'm not equipped to take care of my mom, but I had to.
Right.
That's, that was my mama.
Right.
So I had no choice, but we used to walk around the track. And one day we was walking and her foot was moving by itself. And I said, Mama, did you see that? Oh, that's nothing. But it concerned me. This is before I brought her into my home. We took her to the doctor. They just said that was normal because of her age. And I was like, oh, okay. In my brain, I said, okay. But I went out of town. And every time I go out of town, my cell phone is right here. Even though I had siblings right here in Tulsa, I came home from off my trip and went to my mother's apartment at 10:30 at night. And my mama was in the tub with no water. She had been there all day long. And that upset me so much to where I took her and brought her to my house and just told all of them, starting this day, I'm going to take care of my mother. I worked a full-time job. I was married. She missed no church services until she got to where they finally said she had dementia. Was it dementia? They finally said that's what she had, but she had got to the point where she quit talking. She wouldn't talk to nobody. She'll move her head. But my oldest sister took her in, and that's when she wound up in the nursing home. And then that's when my daughter took her out of the nursing home, and Beverly stepped in. And when Beverly stepped in, we started sort of understanding it, but it was at the the final stage. But she died of a pulmonary embolism versus the dementia, which that confused me because I thought one was the mind and not the physical. But
and see, that's the confusion. But one of the things that we can do, just as professionals, just as members in the community, is to help educate our community about the 10 warning signs, the stages, and all of the things that we need to do in order to get healthier, encourage our families to do what it takes to get ourselves out of the statistics and the numbers of dying. They are saying, because of all the disparities in our community, that we are dying earlier than any other race. It's going to be on us to make those changes. I just want to thank you. I know we can't cover all the conversations today, but I want to thank each of you for sharing. We've got a long way to go. We have a lot more that we need to talk about. I hope that you will join us at this table again for this conversation, for continuing the conversation, so that we can do better as members of a community, to represent, to know how to advocate for our loved ones when we go into a doctor's office, to know how to talk to a doctor, to know the questions, to write them down, and to be able to look a physician in the face and know what you're talking about, or make them think that you know what you're talking about. Because a lot of times they are not listening. A lot of times they have made up their mind and they have that 15 minutes and they know they've got to move on. So sometimes you got to know what you want to talk about, know what you are dealing with, know what your loved one. Another thing that we need to do is make sure that we have the legal rights to assist. There are so many things that educate, that we're not educated about when it comes to the legal rights of taking care of our loved ones. It is so many issues that put us in the disparities of this nation. So we're going to do better. Starting at this table, we're going to continue to educate, help one another, be accountable to one another, and let families know when we see someone struggling, send them to someone. Recommend. We do free consultations, you know, and what we can do, we know the resources. We send people to the right places to get the services they need. We need to know that so that we can help one another. I want to thank each of you for coming today to discuss this with us. This is just the beginning of the roundtable discussions and the health disparities in the African American community and diverse populations. We have a lot of sisters and brothers that are Hispanic and of other races that need this information just as much. We're partners in this struggle. So the struggle is still real, but we're going to do something about it. All right? Thank you for joining us.
Question, how do we make the world a better place? How can we move beyond the pain of yesterday? Maybe together we can restore faith in humanity. But it's gonna take courage to make a difference. Getting tired of the way things are. No time for blame. Let's be the change we want to see. Yeah. 'Cause we all wanna be loved. We all wanna have peace. Everybody needs to be heard, and that's just the way it should be. But we can't judge each other, no. 'Cause we're all the same. We stand up together. Said we're ready for change. Together, united, you and me. Love is invited. Your actions speak, yeah. It takes all of us, every one of us, to make a change for the better. So can we be less like enemies and more like family? More like family. So let's keep looking forward to tomorrow. We'll face the sun and let the shadows fall behind. Joining hand in hand, it's time to take a stand. I believe we can. Singing yes we can. Ooh, I believe. Together united, you and me. Love is invited, and your actions speak, yeah. It takes all of us, every one of us, to make a change for the better. So can we be less like enemies and more like family?
We are all part of one amazing humanity. Our strength is in the power of this thing called family. As brothers and sisters all working together, we truly can make this world so much better. Let's not make this just another feel-good song. This is our call. It's time to get along. Together united, it's you and me. Love is invited. Actions speak. It takes all of us, every one of us, to make a change for the better. So can we be less like enemies and more like family? Together united, you and me. Love is invited, and your actions speak, yeah. It takes all of us, every one of us, to make a change for the better. So can we be less like enemies and more like family? Let these lyrics come alive in our deeds, 'cause it's about love, sweet love. That's what the whole world needs.